Well, my name is Jim Netterville. I'm the chief of the Head and Neck Cancer Division in Ear, Nose, and Throat at Vanderbilt University. Well, I grew up here, went to Lipscomb University. I then went to Memphis, Tennessee, the University of Tennessee for medical school. And then in 1986, I came back with Dr. Ossoff and Dr. Dunkevich, and we founded the ENT department here at Vanderbilt University.
I'm also in the head and neck surgery division within the Otolaryngology department. I'm one of 7 members, and I've been here since 2004 when I started my internship.
You approach the world with your face. You communicate with your face. This is what people see. So when I was a young doctor, medical school residency from the late 70s to early 80s, we were taking half of people's heads off and barely getting them back together so they survived, but their quality was down. And then we learned how to take pieces of tissue completely from another part of the body, like the arm or the back or the leg, and take the vessels loose and sew them in place and use that tissue to reconstruct people to get them back to closer to normal. And it takes some very special creative doctors to do that, and I'm not one of those. So I got my genius young partners to do that, and Dr. Rodi is setting standards around the United States and the world and how to reconstruct people. When I was growing up in Nashville, Tennessee here, we didn't really have a concept of out-of-our-borders healthcare. So in 1999, my brother, an anesthesiologist, a small group of us went to Nigeria for the first time, and in 2 weeks operated on 100 major head and neck cancer cases. But I saw right then, our real role was not to go operate on a tiny amount of patients, but to go teach the world, take our education and take it out of our borders.
My first opportunity to do medical outreach was with Dr. Netterville, and that was in Nigeria. And for me, it brings medicine back to its roots. And so every year when I go, it recharges me, it rebuilds me, and it reminds me what medicine is all about.
We have 2 levels of training in otolaryngology in our department. 3 really. We're training medical students, but then we're training residents. We get these young residents, they come in as interns, they spend 5 years with us, and then they are eligible at that point to be an otolaryngology head and neck surgeon anywhere in the world. But our specialty has so many unusual, difficult things that many times a primary care otolaryngologist doesn't want to do that stuff in their office. Tertiary quaternary head and neck cancer surgery is such a difficult, time-consuming practice that it's not conducive to most private offices. So we have fellows, advanced head and neck fellows that learn that very well. Our fellows make their life better. They bring we have fellows from Harvard and Michigan this year. Now our senior residents are learning from Dr. Rodi and I, but they're learning from all the faculty at Harvard. They're learning from all the faculty at Michigan, 2 of the best programs in the country on top of that. So now these fellows then go out to most academic centers in the United States and expand what we're doing to many other programs. So Sarah, I saw in her eyes what a great young doctor she was, and then when she decided to be a head and neck cancer surgeon, I was pretty darn excited. Like a father and your kid wants to do what you do. So it was remarkable.
I think it's interesting because Vanderbilt has a lot of our original faculty members. Dr. Ossoff recently retired. I still have Dr. Netterville here with his, experience, and he sets an example from the top, as does Dr. Evie, Dr. Haynes, our senior faculty members. They set an example that taking care of patients is more than the science and the medicine, but it's about them as people. It's the same when it goes to teaching the residents how to do surgery and become doctors. It's about their whole person. It's about the whole person of the patient. And I think that comes from the top, and I think that's what makes another thing that makes our department special.
We get up every day to come to work, to hang out with some of the brightest young medical students and doctors in the world, and our goal is to make them not just the best students, best residents, but the best doctors in the world. And so it has been exciting to see her be such a role model to other young females. Say, wow, I can do this. I can be a world-class doctor. I can be a microvascular head and neck surgeon, one of the most difficult things we do, and I can still have 2 great kids and have fun and run marathons every other day. So
Vanderbilt is an extremely collaborative place. It's a friendly place, but I'm also among some of the smartest and most talented surgeons and physicians I know. And that's what makes it special, and that's what kept me here, is that I can thrive. I can always ask for collaborators. I can always find someone who knows about what I need. The undergraduate campus is right nearby, so we have access to the business school. I got a business degree since I've been here. We have access to the divinity school, the engineering school. We have access to everything that we need to succeed.
When we interview, we look at 450 charts a year of future medical students that want to be otolaryngologists. We're very blessed to call that down to 44 people we interview each year, to pick 5 to be residents with us. And we're looking at their genius across the board. The medical students are the top young geniuses in our country. But we're looking for a human spirit in them. We're looking for some compassion and care, because that's the core of being a great physician, is to care about your patients. And so we're trying to bring in young doctors in our department that are going to be the next Sarah Rhodey. They're going to be world-class physicians, but they're going to care.